Hello and welcome to We the Students, a political discussion sponsored by Nauset Regional High School's AP U.S. Government and Politics program, in collaboration with Nauset's video production class. According to a recent public opinion poll by U.S. News and World Report, nearly 70% of Americans say the nation's healthcare system is in crisis. Healthcare costs continue to increase, taking a bigger bite out of the family budget. Many Americans live with the fear of being just one major illness away from bankruptcy. And now with the start of the 2020 presidential campaign and the upcoming primary system, the healthcare debate is once again coming to a climax with people on the left asking for universal healthcare and people on the right asking for a free market approach. Behind this ongoing debate is a simpler and more profound question. Is quality healthcare a right or a product to be purchased in America? Over the next 30 minutes, we will attempt to answer that question as we discuss the state of healthcare in the United States. I'm your guest host, Brendan Hamady, a senior here at Nauset and the veteran of its AP government program. Just for the record, opinions expressed here belong to the panelists and are not the views of Nauset Regional High School or the Nauset Regional School District. Now, let's meet our panel. On the side of healthcare being a right, we have Kobe Jolks, LMA Dixon, Bennett Hartley, and Finn Riley. On the side opposing them, we have Rachel Pranga, Izzy Nobley, and Kieran Norton. So to open, I would just like to ask the debate question, is healthcare a right or is it a product?
I'd like to start off establishing the idea that healthcare is not a right, and healthcare cannot be a right without violating the rights of other citizens in the United States. For example, in our Constitution, there is no right that demands the service of another person, and that's exactly what healthcare is. It requires the service of another person. Everything in the Bill of Rights is a liberty that cannot be infringed upon, but it does not require the service of another person. And to demand the service of another person would violate involuntary servitude prohibited in the 13th Amendment to the Constitution. So you cannot force the service of another person and demand it a right by violating other rights.
Are doctors being forced to work?
Yeah, well, if you can't just knock on the door of a doctor in the middle of the night and demand that they treat you because it's your right. And furthermore, if healthcare becomes a right, then other things people will demand more from the government, and they might say that education is a right or food is a right, and then it'll just place more and more demands on the government. Mm-hmm. Just because something is a noble cause doesn't necessarily mean that it's worth it to go super in debt because people think it should be their right.
You may think that it's not a right, but the United States and 47 other countries signed documentation saying that healthcare is a fundamental human right that should be given to everybody.
Just because something is declared a right in this document that's signed, though, doesn't mean that it's a right and a liberty in our Constitution. For example, in the United States, people have the right to an education, but that right does not surpass a person's First Amendment right for free exercise, as exemplified in Yoder versus Wisconsin. But just because we're saying this, that isn't a right, we can still create a system that is affordable and accessible to all. The best way to do it is not just by declaring it a right and taxing everyone upon this. There's systems that we can implement that we'll elaborate on later that would provide better system of healthcare than just declaring it a right and snapping it into thin air,
And this concept is actually kind of brought about in the Obamacare, or the Affordable Care Act, which was passed in 2010. And that plan implemented a system called the individual mandate, which required a tax penalty through 2018 on those who failed to have required coverage. So what it did was it required everyone to buy coverage and purchase coverage, or healthcare coverage. And so what that did was that was the federal government saying you need to purchase this product. And the federal government can't do that. It was upheld in a 2012 Supreme Court case, the NFIB versus Sibelius. But then in 2017, the Tax Cuts and Jobs Act was passed by President Trump. It was signed in 2017. And what it did was it repealed the Patient Protection and Affordable Care Act's individual mandate. And so basically what that did was that took away the system of you have to buy this product or you have to buy this healthcare package or we're going to tax you, we're going to penalize you for that. And so that kind of highlights the idea that the government can't say, oh, this is a right that people are going to have, so you need to purchase this. You can't force someone to buy a product. So I think that's a big issue and a big thing that was brought about in that act. And so I think it's just important to highlight the fact that you can't force someone to have a system. Even if it benefits them, you can't force anyone to purchase something.
We're not forcing anyone to purchase anything. We're not
Exactly.
proposing the Obamacare. We're not proposing
we're
the
not
Affordable
advocating
Care
for
Act.
What you're
Obamacare.
proposing
But we're
is putting
proposing-
our country
But
$32 trillion
you-
into debt
we
in the next
can-
10 years of implementing a universal health care
We
system.
can increase someone's taxes. Taxes aren't something we're not forcing. Like we're not forcing someone to buy something.
Well,
we're just
the issue
tax-
with that, though,
taxes
is if you don't
but everyone has
have
taxes.
the issue with that, though, is if you don't have enough people supporting the system, and so like, if you don't have enough people contributing to this pool of money, so say someone is an outsider and they don't want to participate, then that pool of money that you're going to use to fund this universal health care, so if you're going to charge people taxes and make them pay, if people are dropping out and you're not forcing them to buy it anymore, then how are we going to get the funds for it? How is
Yeah,
it
so
Well, taxes are way less expensive than having people pay for privatized healthcare. Like privatized
not.
healthcare is very
Yes,
expensive, and a
necessarily.
lot of
Yeah.
people in the lower levels of like the financial
Well,
standpoint
social-
can't afford that.
It's simple economics that drop the cost of healthcare on a free market. In the U.S., we spend more than any other country in the world on individual healthcare, and that is not because it's unregulated. It's because these insurance companies. There are several causes of it, but the major ones is that these insurance companies cover every single bit of healthcare that one could need, and a lot of people can afford the basic care off the bat, and they charge these high administration fees. To raise the price of the healthcare. Another issue is that people are coming into emergency rooms completely uninsured, and when they can't pay for it and they declare bankruptcy, that money goes into increasing the price as well. And then finally, another issue is that once people pay their deductibles on their insurance, they have unlimited funds basically to do whatever they want. And since we have good health insurance, they're like, it's just like free candy. They're gonna get as much as they want.
Well,
And
with
when you
free
realize-
health
and our
insurance,
healthcare is 37
people are going to
kind
be
of-
insured, so that they're not going to be able to game the system where you walk into an emergency room and you're getting free service, and the people who can pay for it are paying for it. If everyone's insured, then that's not going
And
to
it's
happen.
very
Well,
low.
don't
You also
think
have to
it's,
take into account that we're
We
30
have to stop
doesn't-
equating quality with expense. In Taiwan, they have an 85% approval rating of their healthcare system, which is largely single payer, and their general
well,
spending
LMA.
is 6%.
Do you think you could define the term single payer for the audience, because
Uh-huh.
many are unaware?
Single payer is kind of synonymous with the free healthcare idea. So the single payer would be the government, and the single payer is paying for every citizen's healthcare. That's essentially, in Taiwan, they have an 85% approval rating of their healthcare system, and their total expenditures on healthcare are the lowest in the world.
Yeah, but
Also,
also,
why
LMA, although universal healthcare may look good on the surface, when you actually go into like what that actually means, it's actually can be really like detrimental to the quality. Like in Japan, like doctors can only see their patients on an average of 3 to 5 minutes because they're not getting paid as much, so they have to make up for that in volume. And also, it doesn't mean that everybody has the same access to healthcare. Like, they all have healthcare, but then they don't have the same coverage. Like, the government might refuse to fund someone's treatment because they think that that person might not survive that many more years, so they don't think it's worth it to.
The quality of healthcare is the 3 to 5 minutes is for people who have non-emergency issues. They're going in, they have a cold, they have a headache, they have something wrong. But with a universal healthcare system, if you have an emergency, you're going to get treated, even if the wait time for an MRI might be a long time. But if it's an emergency, you will get
Yeah,
treated
but
immediately.
wait,
Yes, necessarily.
There's actually-
wait, Bennett, in Canada, there's like an average wait time of like 24
Yes.
weeks for
Well-
a simple surgery such as like knee surgery or hip surgery.
Yeah, but you're not going to die if
And
you can wait
5
that
hours
long.
in the
Still,
emergency
that's a lot
room
of months
for
to
people
wait.
65 years or older is the average.
Right.
So the only options that you have for these systems to create a good universal healthcare system is to create like an absurd tax like they have in some place in Europe, which Americans would not support at all.
Well,
Like
also-
And I
Sweden's
also-
61% tax,
No.
Denmark's 55% tax, or you create these absurd wait times and low quality healthcare that's inaccessible to people. Why do you think people
Well,
come to the U.S. for the best
And I
healthcare?
actually have
It's
a
because
fact
we've
that-
created a competitive market.
You say all this about the emergency room, but there'll be way more preventative care, and it'll lead to less emergency room actions, which cost more money than obviously than regular appointments. So
Yeah, people who
However, an
people who
emergency
can't, who
is
don't have health
defined-
care, and they say, oh, I'm not going to go to doctors because it's going to cost me a ton of money. They go straight to the ER, which costs them thousands of dollars. and they don't have
Actually,
health
if
care to pay for
healthcare-
that.
There's
people wouldn't be
a-
scared to get preventative
There's
care.
a
and
legislative
therefore
act
that there would
actually
be
called
much
the
more healthy
EMTALA, or
people.
the Emergency Medical Treatment and Labor Act, and that was a federal law established in 1986. And that law states that you can't deny that it requires anyone coming to an emergency department to be stabilized and treated, regardless of their insurance status or ability to pay. So what that says is, if you're arguing that people who have emergency situations, they don't want to go because they can't get treated or they can't afford it, there's actually a law that states that they can't be denied care.
Well,
So
we-
Yeah,
But
we
the
know
thing
that-
is,
so-
they're not going to be denied care. But in a privatization system, the price for people who can pay is going to be boosted
Yeah,
by
let me
a
touch
lot
on-
because
If
people are
healthcare is
being able to
free,
get in the system.
more people are going to want to take advantage of that, and
Right.
then so more and more people will see the doctor for small things like headaches or like lack of sleep or something, where it'll take away doctors' time for addressing more serious
Well,
Yeah,
what
I
about
think
people that
Rachel-
can't take
They
advantage
cost
of it
you a
because
lot.
they don't have
Doctor
enough
just to,
money to
like,
go?
use it. I mean,
Well,
it's
but
not
people will if it's free
necessary, right?
because there'll be less of a financial consequence.
Would
Right.
you rather
So-
use it too much or not be able to use it at all?
Well, they have to deny that to ration out their health care over the entire nation. So the government, it's not like about you, it's about how much of the government's resources they want to spend on each person.
Well,
You
what about the
just-
people that
Wait, Finn,
can't
I'd like
afford?
to ask you, how would you fund this universal system in terms of taxes? What would be the tax?
Well,
rate
you would
that
have to.
you're looking at?
You would cut from government programs such as you spend over $500 billion on the military, and that's just
You're not
unnecessary.
going to have people to provide health care for if there's no military. But
Well,
I mean,
right
that's a whole
now
different
is-
topic. I
that's-
don't
That's
necessarily-
that's
Well, I'd like to kind of, with what Kieran was saying with the funding, I'd like to remind us all of our national debt, which is currently rising very rapidly, and it's at 22 trillion. I'm not even going to read the numbers because after that it's still rising. So the fact is we can't, part of that is Medicare and Medicaid. They're actually the number one expense of that, or the number one component of that national budget, and that's in the trillions as well. And so the reality is, if we want to establish this free system, it's going to come at so many costs, and it's just not going to be able to sustain itself realistically. Because you can't just continue to tax, or you can't just set up this blanket system and have everyone pay taxes and make it all go away, because it just realistically that can't work.
According to the American Medical Association, if we cut spending, if we go to, $1.8 trillion will be decreased, spending on health insurance
would that
and
happen?
medical over the next 10 years if we go to
sounds
How would that
universal healthcare.
happen?
Because the prescription drugs will be mandated by the government, and so the pharmacies are businesses. Pharmacies are businesses. They will increase
Right.
their prices to make money.
Right.
If they're controlled by the government, they'll be regulated and mandated so that the prices don't go high.
Well,
If
you
you want to
can't
buy
there's a
control-
way
you
to
can't
do that without
control a
violating
private
personal
company, though.
liberty.
You can't control a private company.
Yeah, let
I
me.
have a
The private sector is
question that
different
ties into this. Because you brought up pharmaceutical companies, patents and such government protections of the pharmaceutical companies allow them to have virtual monopolies on the drug prices and the drug system in general for their specific products. How would you say that we could address that in order to fix the prices that you are so concerned about?
If you wouldn't mind, based off that, could I touch on a system that I think could be proposed, and I'd just like to hear
Well,
your thoughts
before you
on
get
it.
into that, I
Okay.
just want to say, when you treat healthcare as a business with privatization, when you treat hospitals and insurance companies as a business, you're not going to get the best coverage for all American citizens.
But
Because
how else can you
That's how
treat
the
it?
system
How else
will
can you
work.
treat it, though?
businesses waste
costs
money
right now.
on administrative costs such as billing,
Insurance
advertising.
companies do. If you create a competitive market, it'll
But
drop
hold
the
on.
price.
And
Private
if you-
sector is a
and
lot
if-
more
you wouldn't be
efficient
so worried
about
than
insurance.
the national
So we get rid of
government.
insurance?
If you
Why-
have a
Well,
free market
okay.
system where it's a direct consumer to their insurance provider or to their doctor, then you're going to erase all those excess costs. And like Rachel was saying before, people are just, our culture today is so reliant on this system of, if you see in sports all the time, if someone like stubs their foot or something, they're like, oh, I can't practice anymore. I need to sit out. We're becoming so sensitive, and I think, like Rachel was saying, people are just going to take advantage of the system and waste those costs, and so all this money it's going to be so inefficient because we're just going to have this blanket system. So, if I run into a tree and I hurt my arm, I can go to the doctor and they'll cover it because I don't have to pay.
But
well,
it's
they
so
already made a
wasting-
point that the doctor's appointment would take long to schedule, and so they can't
based on
abuse
your
it.
system.
Right.
They can't abuse it if they're
If it's a private
they
system,
can't,
so it's
they can't abuse it if they're
between
going to have
So
to
you
wait
create
long.
an
But if it's-
inefficient
exactly.
government program for one of the most vital things in people's lives.
Okay,
So, I mean,
okay.
just
But-
let me touch on this for a
Well,
second.
Hold on,
because
Karen.
it's a combination of the free market and also a basic single-payer system, like you guys are supporting, but without all the debt that it would necessarily.
Well, talk
involve.
about
these insurance
inefficiency.
companies are just
How about the
trying
fact that the people who need health care the most are typically the people who are lower income? And so right now,
That's true.
there's a divide in people who have access to health care because of their incomes and people who need
So
it.
let's create
That's
let's create
inefficiency.
equality for them by implementing a free market. A prime example of success in the
Can't
free
afford
market
it.
is LASIK eye surgery. It used to be tens of thousands of dollars, but through the free market, insurance companies won't provide insurance for it because they just don't want to, and the prices have dropped significantly to thousands of dollars instead of tens of thousands of dollars
But
over the
people
years.
can't- People can't
9% of
afford
So
that.
that's why
low
you
income
create a
health
single
care.
payer system for the bottom line of it. So what I'm proposing
A
is
two-tiered system.
yes. So basically, it's a fundamentally free market with the interactions directly between the healthcare provider and the consumer. Then obviously people can't afford, like, say if they broke their leg and they have to pay like $100,000 for a surgery or something. Then insurance companies can come into play and they can provide services, but it's not going to be as expensive because fundamentally the free market will drop prices with the direct interactions. And then finally, there still will be a single payer simplified system, kind of modeled after what Medicaid is now, but you're going to cut Medicare, which Medicare is a 1.45% tax on every American, and resulting in a $211 billion surplus that could be pushed into that kind of lower level single payer tiered Medicaid system, where the people on the upper echelon of that will be able to pay they'll be able to pay maybe for just their basic care, but they'll be insured for the catastrophic events, and then the people that are like dirt poor will have their entire
What about the
Wait a
people
minute.
who are middle class? The middle class who could possibly pay for healthcare, who could possibly pay for these surgeries.
But they're
that
still
money
gonna be
is
wiped
going
out
to, is,
by
yeah,
one
no,
catastrophic
they'll be able to.
Why
event.
would their
Because
income-
the free market will drop these prices.
Right.
It is proven.
Because
the
what's
free
hap-
market creates competition. That's how economics works.
Exactly.
If
Yeah,
university
so the
Well, well,
insurance
if
companies, the
doctors
prices
are
rise, and then
charging
There's
for
no
the people
insurance
in the lower.
companies for basic care. It's only for catastrophic events. So all these
minute.
administration costs are cut, and it's direct interaction. That people are more frugal buyers, so they're not going to overconsume all these services that they need.
But by your definition, aren't you saying that single-payer health care is an inferior quality? So people during these catastrophic events, are you saying that
The competitive market's going to increase the quality while still providing
still in the
this,
single, with having that
Yeah, because
single-payer model?
it's still the private healthcare service that's funded by this Medicaid system that would be implemented, and it would be vastly more affordable. I'm proposing maybe less than a 1% tax on each American, which would be less than the Medicaid tax, than the Medicare tax is now. I mean,
But what about those people in the middle who are neither very fortunate and able to afford a privatized healthcare system, and they're not low income?
These
These
and
people are
affordable.
deciding whether like they
but
want
they're
to feed
still
their
going to be
families or they
wiped
want to
out
get
by
health
one
care.
catastrophic event, and
What are-
that's
what
just
are they
They're
gonna
not,
do?
unjust.
instead of like a surgery being tens of thousands of dollars, it's going to be lowered to thousands. Instead of a service
And you're saying
being
that's
thousands
because
of dollars,
the
it's going to be dropped to
competitive
hundreds.
nature of privatization?
Yes, that's what's going to happen.
But what about
That's
all
what
the
happens in
administrative
everything.
fees, like for billing? If you don't
Without
have
the insurance
a business,
companies for basic cares, it's direct interaction. There's not as much of this administration and
well, that's
bartering
what single
for
payer is.
healthcare
It's
service.
direct interaction between the
Yes,
government
but
and
it's
the
absurdly
health
what
expensive.
what single payer is it's you get lost in all of the, because like we were talking about before, it's not just you go for what you need, but all of a sudden there's all these different things are being covered by the government. So what Kieran's proposal kind of talks about, or just a free market system in general, is whenever someone needs care, they can go directly to their provider, their doctor, their primary care physician. And if you don't really support the idea of kind of getting rid of insurance companies, and except for emergencies, they can also just have that direct interaction with their insurance companies. So it's just what that would do would just get rid of all of the kind of gray area, in the sense that the actions that people would need to fund their programs or their needs, like their health needs, it would just be completely between either their insurance care providers or their primary care physicians, if they can just pay up front. And I think that system makes so much more sense realistically, because one, our government just can't fund a blanket system, and two, it just gets rid of the idea that people could abuse the system or all these unnecessary.
Why don't we stop giving jobs? Like doctors make over $200,000 in income every year. All these jobs make all this money. We could take some of the money from all these like high-paid jobs and use that towards a healthcare.
You want poorly paid doctors to provide service?
I'm not saying poorly paid.
I mean, it's not gonna. Part of the free market is a benefit. It creates incentive for doctors, like in the U.S. now, to provide good service. That's what it's created. But cutting out these insurance middlemen is gonna save price. I mean, in this plan, there's literally like every single thing is a benefit. Taxes drop for Americans. There's more equality and affordability for all with the single payer system at the base of it, rather than applying it all across everyone. It allows people personal liberty to shop around for the health care that they need.
The only way that
Is
we're
it-
going to
wait,
have
Guys, we're nearing the end of our discussion, so I would like to ask one more question, since we seem to have a back and forth on this. Pre-existing conditions. One of the main criticisms and concerns regarding the healthcare systems is that people who have diseases from birth or have issues that will be prolonged through life can't get access to quality healthcare or have higher costs. So, Finn, we haven't heard from you in a while. Would you like to address this concern?
Well, I think that's mainly why we'd have a single-payer system, because quantity over quality, that's mainly what you want with healthcare, because you can't just let people with those pre-existing conditions have to pay more. And-
What could they do to control their pre-existing conditions?
45
With this system, pre-existing conditions would absolutely be irrelevant, because you could get covered whether you had a pre-existing condition, whether it came up. It doesn't matter. It's a free market. You just get it when you
But that's
want.
not what
And
we
if you
have
can't
right
afford
now.
it, you have Medicaid. I know the system that I'm proposing.
Izzy, you keep bringing up a point about people abusing the system.
Yes.
Abusing it. What about the 45,000 people who die every year because they can't afford health care? They wouldn't be abusing the system. They'd be using the system to survive, to not die.
Also, Bennett, another concern is that 5% of people consume about 50% of the healthcare costs which are generated each year, and on the other hand, the healthiest 50% of people consume just 3% of healthcare costs, and that reinforces the fact that we'll be paying for other people's healthcare, and most of the cost comes from chronic diseases that could be prevented by simple lifestyle modifications. And so if people just need to be more responsible for their
Would you
own
rather have a
health.
percentage of your country be healthy or your entire country be healthy?
Everyone, that's what
what
we-
you asked me was, I think I'm not opposed to having coverage by the government in some areas. So maybe people with chronic diseases or illnesses that they can't control, maybe we can target that population similar to what Medicaid and Medicare do. They target low-income populations or the elderly, people 65 or older. So maybe that's a better approach. I just don't think that, Rachel brought this up too, a blanket system where all of a sudden, maybe I only go to the doctor twice a year. Why should I be paying for someone who's
Our
going
system, the average
once a
now,
week or twice a week?
Yeah, you're misinterpreting exactly what we're proposing. We're proposing the affordability of the free market coupled with the equality of a single payer system at the base. So it's kind of the best of both worlds. Both sides of us, we want good healthcare and we want affordable
Right,
healthcare.
and we don't want anyone to not be able
guys,
to afford it.
We just hit the 5-minute mark. So on this note, could each side please give a brief concluding statement to wrap up the argument?
I'd just like to say, I don't disagree with what you're saying about your system, but realistically, I think that based on precedent and history, the only way to achieve equality in terms of access to healthcare, quality of healthcare, and cost of healthcare is through a single-payer system.
I think that we've been,
Per person.
you talk about the
Per
precedent
person.
or history, I think we've been targeting this problem for years and just approaching it the same way, trying to make a blanket system or cover large groups of the population. But I think we're approaching it the wrong way, and maybe the real question is, how can we not necessarily just jump to the conclusion of making a blanket system and racking up taxes and making people
The thing
pay
is,
more.
our
Yeah, but
system
taxes
now-
are
forcing
way
people.
less than
Well,
paying for
where's
private
personal liberty in the land of the free? Where's his personal liberty to
Forcing
choose
people
what
to
you want?
have
Okay, well,
health
you
care.
can
It's
tax
not
people
necessarily
for
for
the
the
law.
Care Act.
That's
The government-
exactly what
you pay
Obamacare
taxes.
is
The
mandating
government
health
forces
care.
Why
We're
should
not
pay
talking
taxes
about
anyways?
We're
Obamacare.
not advocating for Obama.
Okay,
That's
but
the first step into a
Obamacare was
single
a
payer
single payer
system.
system.
Kobe,
Yeah,
it's
but
the first step
Obamacare-
to a single payer system.
Exactly.
Yours would be even more extreme than Obamacare.
Taxes
Right.
aren't
Why can't
extreme. You pay taxes already.
Yeah, but why
The-
should you
we're
pay
not
taxes
forcing
for
people to
something
purchase
that
a
you're not
bundle or
doing?
anything
Well,
like that. They're
you want
It's
the-
easy
you
to
want the
say that when you're
61%
not one of
tax
the
rate
people
of
that
Sweden?
can't afford
Really,
healthcare.
61% tax rate for Americans.
Our tax- your
that fought
taxes-
for the freedom of this country to avoid taxes.
Your taxes for our system will be less than what normal people pay for premium healthcare a year. Our taxes will be less than that.
Why can't you, with this system though, you can allow personal liberty and you can also keep the prices down to less than 1% and provide Medicaid for the people on the lower echelon.
Also,
But
you're
when has
talking
the
anything
people
like
in the
that
middle,
ever
though.
worked here?
Our system right now
when is it,
in the
when
world,
is a system like that
the
ever
United
Well,
States
when has a
healthcare system
single-payer
is ranked
system ever worked?
37th
Every
in the
country.
in
world.
lots of other
Out of
countries?
Like
With
every
long
Western
waiting
European
times,
country.
and
But
less
the thing
quality.
also-
We have
the
the
US is
Long
the
waiting
highest
times, but
income
everyone's
country.
healthy.
medical
and our
innovation.
healthcare is terrible.
If you have a terminal illness, the place that you come is the United States to get the best health care.
If you have the
Right.
money,
The quality might be
That's-
the best, but the system is ranked 37th in the world.
And
We
that's
do
why
not
I'm
have-
proposing.
Right,
the
but why would
system
you
to
go
get
to
Medicaid.
high income
Why would
countries
you
should
seek
be like that.
mediocre
Advancements
care? Why
in
would
the
you seek
US.
mediocre
Hold
care?
on. Because you
instead
won't
of
have the
going
money to
back
pay
to
for
your
it.
doctor?
Who's
Why
gonna
would you
say
want to
it's
do
mediocre?
60,000 Canadians
If it's-
come to the United States for our healthcare, and the U.S. is the leader in medical innovation.
Right.
And if you have a universal care plan, then there's less funding to go to like new research and new advancements. So like we're working on like new cures and stuff, and those will never be created or invented that will
That's-
help people in the
well,
future.
that's not true.
A
There's
if
country
there's
like
less
Canada has taken in the
funding.
universal healthcare system, and their life expectancy rates are way more than the United States.
Then how come they still
That's
come to
the
the
why are
thing.
they
United
coming
Life
to the United
expectancy is
States
kind
then?
of something that you
So
can't
you
base
can't talk
all
about
the
the
healthcare
how
system
bad
has
our
to do
quality is
with
going to be if our life
expectancy.
expectancy
A
is
part
already
of the
low
life expectancy
compared to the
issue
counterparts
is that
that are
people in
using.
the U.S. don't live as healthy lifestyles as people in other countries. You have to take a little personal responsibility for the lives that you live and your health.
So you say-
was the
Yeah,
thing.
Rachel-
So healthcare doesn't
Rachel-
have anything to do with
Rachel
that.
actually
No,
had
Is
a
that what
really
you're
good.
saying?
Rachel had a
Healthcare
really
does
good
have to do with
statistic
that.
in that regard about the obesity and just lifestyle choices
But
because
before we
the
move
population that you're talking about is 40% of the population of Americans have incurable or chronic diseases. So yes, they can help it, and I'm not trying to sound insensitive towards them, but maybe what about that 60% of the population that doesn't have a chronic or incurable disease and they just are, the average person, and maybe they have other health risks, but they're not, they're not dying of a chronic disease.
Well,
Why don't
if
we
you-
target
okay,
the
well-
population that has that incurable
can't
disease
What
and
about
make a
the people-
system for them?
those
Why are we
things?
making a giant blanket system
Is
for
it- you can't
90% of the
predict
people in the
those
United
sort of
States have
things. People get
can't-
ill. People have catastrophic events. That's why
What
you
if we
give
propose
Yeah,
a
9%
system?
of
So,
the
so
people
why
in the
not
United States can't afford healthcare.
provide
And
accessibility to healthcare for all for an affordable cost by creating
you're
a
saying-
free market with lowest prices
Right.
Would you saying
and
that-
also a single payer system at the base of it
For
where
people who can't
for
afford
people
it.
who can't afford the single payer system. And I think it's implementing your guys' ideas, but the biggest issue, ideally a single payer system with low prices and you wouldn't go into debt and high quality, it'd be ideal.
Are you
Like,
saying
I
that
agree,
like people who
but-
can they can spend the money to get better health care, and then you're covering like the blanket of the people who can't afford
Yeah,
the
and
poverty
it'd still
line?
be a lower
Right.
tax because the free market would drive down the prices and cutting out this insurance middleman.
Right.
So I'm not trying to argue with you on this
Right.
issue. I think you
Yeah.
guys could maybe agree with it because it takes the flaws of the single payer system and tries to adapt with them. You know.
Right. Because there definitely
guys,
are. Okay.
We're nearly done, so could everyone just give their strongest argument to wrap up each side?
Healthcare is a right. It's unjust for people to be denied service to healthcare because of their financial standpoint. Every person deserves to be protected by their government and feel secure in their nation.
And then,
We believe that healthcare should be regulated by a free market system or the private sector and have it be a direct interaction between the consumer and the provider so
Um,
that
unfortunately, we're just about out of time. I wish you could finish, but
okay.
we'll have to hold the discussion here. We thank Nauset High School's television production class and Lower Cape TV for making this a valuable experience for all of us. That concludes another segment of We the Students, a political discussion sponsored by Nauset Regional High School in their AP US Government and Politics class. I'm Brendan Hamady. Thanks for watching.